Is that hurting you?
Yeah.
The heart is not designed for beating faster and irregular. And at some point, it'll give way.
I've got to do something, haven't I? I don't want to have a stroke or a heart attack.
Yeah.
Heavens.
I have a very great worry that I don't want to go blind because I've seen my mom go blind.
So where do you feel the lump? Here.
And when you press it, I can feel it. And that's why I was panicking.
If you just hold her hand, that's fine. Even though I know it's a bit of a struggle.
OK, thank you. Bye. Hello. Hi, come on in. So, how are you doing?
Disaster.
What's the problem?
Oh, it's just everything. Everything's going wrong. The dog seems to be dying. Can't do anything about it.
You've been
Well,
seeing that?
he's 17, so...
Oh, OK, but it's still sad.
But he's incontinent. He keeps having accidents in the house. And I don't know, I sort of think, well... He walks about and loves his dinner. But am I being fair, you know? But I'm putting up with it at the moment.
You can talk to the vet, yeah?
Yeah. And then my neighbour's just doing my head in. Parties nearly every night. They're out in the garden. There's just no peace and quiet at all.
You're going to do something about that if it's causing you stress, yeah?
Oh, it's just doing my head, honestly.
Any thoughts of moving?
Well, I've spent so much. I've spent thousands in the garden.
You need to take control of that one, don't you, David? You can start to get some help.
Yeah, so my blood pressure has sort of gone out the window.
Have you been checking your blood pressure at home?
Last time I checked, it was 192, so I put it away.
Let me do it today.
Is it an urgent appointment?
No.
OK.
Come in, take a seat.
How can I help today?
I'm sorry I didn't check in.
Yeah, don't worry, I didn't know you'd hear.
Well, there was something that's been bothering me for some time. It started a while ago. I started getting like hairs here, and now it's like they're getting longer on my chin as well. And they told me that there could be something wrong with my hormones or something. So I just thought.
How long have you noticed the problem for?
This started like maybe more than a year ago, but now that the ones on my chin are getting longer and like here.
No, but how
also they're
long?
getting...
I mean, time-wise, are we talking a month, a year?
Oh, more than a year.
Okay. Any problems with your periods?
No.
Regular? Okay.
Yeah.
So there is one condition that's associated with facial hairs, although you don't have any other symptoms of it. It's called polycystic ovarian syndrome. And it's basically when you have high levels of male hormone in the blood. We can check for that as a simple blood test. Okay.
They've also told me that this could happen if you have cysts.
Yes, that's exactly polycystic ovarian syndrome. It's the same thing I'm talking about.
Oh,
yes,
okay,
that's
okay.
right. So it means cysts in your ovaries,
Right.
and they often produce this high concentration of the male hormone testosterone.
Also, the blood test will show if...
Exactly,
okay, good.
yes, yes.
Right, thank
Are you happy to have that test done?
Yeah.
Okay.
Have you ever had talking treatment? Talking therapy?
No, I haven't.
How would you feel about talking to someone about your stress levels?
I wouldn't mind, I suppose.
They'd start with a telephone call to you, and sometimes they do it all on the telephone. Would you be all right with that?
Yeah.
You're taking your pills, aren't you?
Yeah.
I have to ask. I'm sure that everything you've been telling me about isn't helping with this, but with your history, we can't leave it this high. In your case, we need to take no chances, yeah? Have you had your bloods done? Have you checked your calcium levels and your vitamin D?
Yeah, I think so, a little while ago.
I'll put some bloods on the system, OK? And I'm going to give you a 10 milligram bisoprolol. We're going to get you back next week to check your blood pressure, OK?
Okay.
And I'm going to do a referral to get you some talking therapies. Okay?
Okay.
Good.
Thank you, Dr. Borgia.
No problem. You take care.
Sorry to move.
Don't be silly and make those calls, yeah?
That's it. Yeah, I will do. Thank you.
Bye-bye.
Have a seat.
A few days ago, my boyfriend, he just noticed I have a lump in my breast. As you can't really feel it, but it's quite hard and it's small.
Okay.
So I rather to come and check. It's only because my father, he died on cancer 6 years ago, and I'm quite anxious with that. So
Yeah, sure.
Yeah.
Okay. So you've never noticed anything before? Do you normally check your breasts?
Yes.
Okay. And you've got no pain or discomfort?
Sometimes I can feel, but before
Yeah.
period, and you know.
Sure.
But
And your periods are regular?
kind of.
Okay.
Not very regular, but
Sure. And you're otherwise fit and well?
yeah.
Yeah. Any change in weight recently?
No,
Any family history of breast problems?
not as I know.
And you said your father died of cancer. What cancer was
Yes.
that?
Throat cancer, and after it was spread. And my mother, she had a cancer of the woman's stuff,
Okay.
and after she had a cancer over here, but.
And how old was she when she had that?
45.
Okay. Chances are it's likely to be benign, non-serious, but even if it is, it means that it can be sorted quickly because you've identified it quickly. So you've done absolutely the right thing, okay? But try not to worry, okay?
Yeah.
Good morning, cancellations.
Good morning.
If you hold the line, please. What's your date of birth? Who's next?
Because your doctor's actually left now.
Who's next?
What time was the appointment?
10 o'clock, darling.
So it's with Dr. Hyder, yeah? Take a seat next door.
Take a seat in the waiting room, please. You got an appointment, darling? All right, lovely, I'll arrive.
Okay, so you're basically looking for any differences between both your breasts and see if anything, your skin tethers in or anything like that. And then you lie down. So just put your hand behind your head. So pretend you split the breast into 4 parts, and then you just basically work your way around each part, just having a feel. And then just any lumps. That feels good. Okay, just for that. So where do you feel the lump? They're here. Not sore?
And when you press it, I can feel it. It's not a pain as, very much, but it's like, that's why I was panicking, because I always make sure everything is good. And obviously when my boyfriend, he checked a few days ago, I was really surprised. It's something.
It's very little there, the knees where you probably...
But if you press it much, it's really painful.
Is
So,
it?
yeah.
Okay. Okay, definitely something there. That's fine. Get yourself dressed. Give me a shout when you're ready. Okay, so there's definitely something there. It's very small though, okay. I do think we should get it checked out, okay? So I'll refer you to the breast clinic. They will see you within 2 weeks. I don't want you to worry, okay?
Oh, I'm worried already, but...
Oh, okay. Common symptoms of breast cancer are a lump in the breast, perhaps noticing a change in the size of the breasts, or finding a lump in the armpit. Pain is not normally a symptom of breast cancer. However, if women are concerned about pain in the breast, then they should definitely talk to their GP. So they will contact you definitely within the next 24 to 48 hours for an appointment, and you're available for an appointment within the next 2 weeks.
Perfect.
Yeah?
Because if not, I will,
No, if you don't hear anything by the end of next week, you definitely need to contact our patient services team here. Really important that you do that. Okay?
I will do.
In the meantime, try not to worry. Okay?
I will do.
Most likely things are all okay, but we should get it checked out.
Oh, yeah,
Okay.
of course, definitely.
All right, take care.
Lovely. Thank you so much.
Bye-bye.
Thank you, yourself.
You too.
Now, you've been sent to me because of
My right arm.
your arm. Okay,
Yeah.
tell me what's been happening.
It's been really painful, and I found my fingers were swelling up. I had to take my rings off, and I'm getting pins and needles all across there. It's really painful around the elbow.
So if you had to point to an area which was the most painful, where would you
Around
point?
here.
Okay, just down to that muscle
Yeah.
there. Now, if I feel up here, is that the pain?
Yeah. Yes.
Okay. So this bit here,
Yeah. I'm doing that.
well, if I hear the right spot, I always like to show it.
Yeah.
Okay, so that area, if you think about your arm here, and you've got lots of muscles that run down this part of the arm into your hand, all of those muscles then go into one tendon, okay, and they insert into that bone there, okay, which is really, really sore at the moment. If you played tennis, we'd call it tennis elbow. There are all sorts of things we can do about it, okay? And I'm going to give you some exercises to take home as well to try and do some exercises with it. I can tell you about a thing called a tennis elbow band, which you can pick up from one of the pharmacies, okay? The thing I can offer you today is an injection, okay? And that's up to you whether you want to take that or whether you want to try the other things first and see how it goes, okay? The injection is not curative. It doesn't stop the problem. It reduces the inflammation in that area, okay? And I think doing things like the stretching exercises and the strengthening exercises that I will give you is probably the mainstay of treatment. And sometimes we will then send you on to physio to promote that even more, okay?
Okay.
Would you like me to go ahead with that?
Yes, please. Yeah.
Okay, right. I'll get it ready.
Okay.
Hi, this is Monish. She's a medical student. Have a seat. Right. And this is Sophia.
Yeah.
Yeah, and we were just sort of talking because we had a little look through. She was here a couple of days ago.
Yeah.
Right, so
It's
tell me what's
7
been
days
happening.
now since
Yeah.
she's been having fever, cough.
Yeah, yeah.
Last time when I came in, and doctor says if anything gets worse, just bring her in. So this morning I found that her breathing was hard, like she's struggling in breathing.
Yeah.
The fever is still the same degrees, yeah.
What sort of level?
It was 38 sometimes and 38.5.
Okay. And we know she's got this problem with her heart still. Is she drinking okay?
She's drinking, oh yeah, okay.
Sophia's got a heart murmur caused by some backflow of her blood from one chamber in the heart to another, and it makes the heart have to work harder than it would do normally. Apart from her problem with her heart, she's got no other problems that I can think of, and no allergies?
No.
Okay. Should we have a little look at her?
Yes.
Okay, that's good. Okay. Hello. Oh, sweetie. I'm sorry. I'm just going to put this in your ear. Okay. I'm really sorry, sweetie pie. You just hold on. I just want to check. Oh, sorry. It's just... I tell you what. Listen. Okay. Listen. That's all right. Okay. I think what I'm going to do is I'm going to try and listen in now, anyway, because I don't think she's going to stop. Oh, sweetheart. I'm sorry, sweetie. I'm not going to bother with her temperature because it's going to be very high, but I do want to have a quick look at her ears, if I may. I'm sorry, sweetheart. If you just hold her head, just the head on it, that's fine. You can hold it. I know it's a bit of a struggle. Excellent. Sorry, that's all done? All done? Look. What's this? It's all done. It's all done. It's important that when children come to see the doctors, they go away feeling happy and content because they'll come back again the next time, not traumatized by the experience. If parents can talk to them about it, explain, then that helps demystify and helps reduce the pressure children feel under when they come to see us. I'm really sorry. Right, she is a poorly little girl. Her breathing at the moment, the rate of it, I'm quite happy with, and the ribs themselves aren't going in. But you're right to bring her back for us to look at her. It does sound as if there's some noises down in this area around the chest, which is different to the other side. It's a little bit sort of noisy, a bit rattly. It suggests to me that there is a chest infection starting there, which is why her temperature's still going up and down and why she's sort of struggling a little bit more. I feel she would benefit from some antibiotics. The proviso is if she starts getting any of her ribs going in or her breathing gets worse or her nose starts going in and out, then you need to come either back straight away here or take her straight away to hospital. Okay? Does that sound okay?
That's fine, yeah.
Okay. Okay.
Thank you so much.
You're very welcome. As I said, even if you have to bring her back this afternoon, don't feel that you can't. Okay.
Thank
Okay.
you so much.
Not
Thank
at all.
you.
Take care. Bye-bye.
Bye.
Bye.
So the object is to find that spot. I pop a little injection into it, okay?
Okay.
Tell me when I find that spot.
There.
Prick now. It is a painful injection.
It is. I don't think so. You think of injections as an injection. No.
There we go. Just put a bit of pressure on that for a moment.
Okay.
Okay, just for a couple of minutes there. Okay, so this tells you all about it. Okay, it gives you some simple exercises, tells you a little bit about the sort of elbow grips that you can use as well, medication. So when that settles down, okay, I want you to start on the exercises.
Right, okay.
If you want to, then go and purchase one of those tennis elbow bands as well.
Right.
And let's give it the next 2 or 3 months and see how you get on.
Okay then, lovely.
Be prepared for the next few days. I'm sorry.
Thank you. Okay, thank you.
Bye-bye. See you later. Bye-bye.
How can I help?
She's got temperature for the past 2 days.
Mm-hmm.
She's got some problem with her tongue.
Tummy.
She's complaining of ache and
Okay.
she's farting and it's aching when farting. And
Okay. So how long has she been unwell for?
2 days.
She's got a temperature now, you know.
Yeah, we've given her Calpol at 4:30 this morning.
Her glands are all up as well.
Uh-huh.
So she's had a bit of diarrhea, any cough, cold, sore throat, or anything like that?
She's got runny nose a bit.
You go, Yeah, my neck will go. Make the noise. Okay. Is it sore at all?
Uh-huh.
Yeah, it hurts.
Hurts, okay. Do you want to jump up on there and we'll have a feel of your tummy? Your tummy pain, when did it start?
When did you start, Nithy? Tummy pain?
It started yesterday.
Where did it start? Can you point?
There.
There. Is it still the same place or has it moved anywhere else?
It's not hurting anymore.
It's not hurting anymore. Okay.
But it's just,
When did she last have diarrhea?
Yesterday evening.
This evening.
my heart's when you press it.
It
That hurts.
What about this side? No. It's probably a viral gastroenteritis. Okay. I'm just checking it's not her appendix. Okay. Do you want to just come and sit here? Yeah. I think we need to take one thing at a time today. Okay. I don't think this is anything more than a viral illness, and the problem is that that viral illness will present in many, many different ways. From now on, though, Calpol, Nurofen, regular fluids, rest, and diarrhea. If she's getting lots of diarrhea, get some diarrhea. I think she'll get better by herself.
Okay.
See you later. Bye-bye.
I live 5 doors away from my first husband. We went out for a month, engaged by the second month, married on the third month, and we lasted 17 years.
Wow.
You've got to grab it while you can.
Absolutely.
Don't get here.
You are mine. Mrs. Khan, please. Very noisy out there, isn't it? How have you been? I've been fine. More to the point, how have you been? Come on and have a seat. Have you been travelling again?
No.
No? You've been at home? It's not like you.
I've been at home because not feeling too good.
Okay.
Now this is the result of my eye test.
Diabetic screening.
They found something, but it's not
Very
serious.
mild. Yeah. But they want us to keep your diabetes under control, I'm imagining, yeah?
Yeah, Dr. Boja, I'm trying my very best because swimming is the only thing that I can do.
So you're swimming regularly, yeah?
Every day.
Perfect. And you're managing that? Your joints are coping
This
with
is
it?
the thing that is
It's
happening
a vicious
now.
circle, isn't it?
Yeah. I'm getting pain here.
In your foot. Tender?
Yeah.
Probably a little bit of wear and tear in there, I'm afraid. So maybe you're doing a little bit too much. Maybe
I'm not jumping.
Is it worth thinking about pulling back on the swimming a little to see if that helps with the ankle pain? It might be that it's sensible maybe to take a little bit more of the painkillers and reduce your exercise. I hardly ever say to reduce exercise. It's fabulous that you're doing that much. And if necessary, take some more of the codidromol. You're taking the lixisenatide and the saxagliptin. You're taking the metformin twice a day?
Yeah.
And you're taking gliclazide?
Yes.
Okay. You're on the maximum of all of that?
Yes.
Yeah?
Yes.
The difficulty is what we would add next, yeah? And what we would add next would be insulin, and the trouble with insulin is it will put weight on you, yeah?
Okay.
So I think the sensible thing to do at the moment would be to watch at this level because your sugar really isn't disastrous.
Doctor, I have a very great worry that I don't want to go blind.
No.
Because I've seen my mum go blind.
Have a seat.
Right, Mum's hearing aid's broke, so she's
My
got
hearing
a drop to
aid's
ear.
broken.
Oh dear.
So,
That's okay.
so I'm absolutely deaf as a post.
Oh dear.
So is it both ears?
Ears, yeah, I've just...
Both of them?
Yeah, I've blocked right up, I can't...
I think I've dislodged something and I can't hear nothing in my left ear. It's quite sore the day after as well.
What did you put in your ear?
Cotton buds.
Oh dear.
The no-nos.
She's got a blocked ear.
Okay.
She's had it about a week. I think it might need syringing.
Okay.
It's so blocked that she can't hear a thing.
Okay.
And then it pops.
Okay.
And then it...
I can hear. Okay.
I hear better in one ear than the other, but that has been for years because I just don't like it.
Yeah.
I don't want to have to be wearing hearing aids.
Yeah.
I hope it's not to that degree.
Past week or so, it's just got worse. And,
Yeah.
well, I can't hear the wife, that's pretty good.
Oh dear. So I'm gonna leave them the way they are then.
Yeah.
How can I help?
I've got a swollen right ear.
Okay. When did it come up?
Bank holiday Monday.
All right. Has it ever happened before?
Yes, it has. It usually goes over my face.
Any other symptoms with this?
A bit tired.
Any problems with your hearing?
No. No. I used to be partially deaf myself, but it's come back.
This in the good side. Have you got itching in that ear?
On bank holiday, it felt like it was like a toothache.
Okay.
Like a throbbing.
Yeah.
And I felt like chopping it off because it was really raw.
Look at this one. Is this causing you pain?
Not really.
Okay. Fine. So the canal is narrower than the left side.
Okay.
Do you use cotton buds at all?
No, I don't. No.
And have you been swimming or anything different recently?
No.
No. Okay. Fine. I mean, it does look like there's inflammation in the right ear. So we sometimes call this otitis externa. But equally, what's confusing is your history before, but whether this is another version of that swelling you used to get.
Oh dear. But this morning I felt like there was a lump coming here on my side of my face here.
Right.
And I thought to myself, oh God, don't start, it's going to come over.
Touch that here?
Yeah.
Okay. I would still take your fexofenadine, but given that you feel this is different, I'll treat this as otitis externa, which would be giving you an antibiotic, if that's all right.
Yeah.
I think flucloxacillin would be an reasonable one to take.
Do you think it's food allergies then?
Have you found any foods that trigger this?
See, what it is, I had, went to the Chinese place and I had some prawns.
Yeah.
But I've had prawns before, but it's never acted. But because it's got soy sauce and other stuff.
Yeah, obviously the clear-cut ones are the ones where people have nuts and things that can be hard to avoid in foods.
Yeah.
But with some of the additives, it's difficult.
Yeah.
But with this came on spontaneously, is that right?
Yeah.
Okay. So that's the antibiotic and that's
Right.
your usual fexofenadine.
Okay.
I hope this subsides.
And
Obviously,
both of them are tablets?
both of them are tablets.
Tablets,
If it spreads to involve the
The
eye
face.
area, then and you're worried, then do come back.
Yeah.
But I'm hoping that won't happen.
I hope
Okay.
so. We're touch
All right.
wood.
Take care. Bye-bye.
Okay then, thank you.
I'm quite careful with my diet because I've seen my mum going blind.
Okay.
So I don't want that to happen to me.
And I think you're doing everything to minimise the chances of that.
Okay.
Yeah?
Yeah.
I couldn't ever say to you it won't happen, but from where your eyes are now, really, you know that you're a long way from anything like that.
That's why I'm keeping to my exercises and everything.
Diabetes can lead to blindness in a variety of ways. Diabetes affects the blood vessels on the back of the eye, and this can cause bleeding into the eye and can also cause some swelling in the eye, all of which can contribute to a loss of vision. The most important things you can do are to control your blood sugar, to control blood pressure, and to make sure your cholesterol is where it should be.
Try not to worry. I know that's really easy to say and difficult to do.
Because my main concern is, I don't want to be a burden to anyone.
Sure you're not. No?
I'm not at present, but in future...
You're being proactive.
Yeah.
Good. Right. So, keep that for your records.
Yeah.
And you'll come back for a blood test in 3 months' time for me?
Yeah.
Good.
Thank you, Dr. Voja.
No problem. Nice to see you.
Nice to see you too. You take care.
Bye-bye.
Okay, bye-bye.
Kenneth Wright. Hello.
Morning.
Come through. Have a seat.
No.
No?
Is that you?
That's me.
Oh, I thought it was the chap with the...
Oh, he's on leave.
Is
So
he?
I'm sorry to disappoint.
No, this is you, is it?
This is me.
Yeah?
Yeah. You're
Yeah.
registered with me.
Yeah, I am, yeah.
Yeah.
Anyway, I'm here for the results of the blood test.
Yeah, okay.
We were doing see how the B12 had settled, and...
Well, you're no
the
longer
thyroid.
anemic. Your haemoglobin level's okay. And your B12 levels, the range is from 180 to 700.
Yeah.
And yours is over 1,000 now. So you're well topped up, I think. So I don't think we need to give you any more B12. Yeah?
And the thyroid?
Yeah, not so good. Can I just check you're not taking thyroxine?
I'm not taking any tablets at all.
But you were on thyroxine.
Yes, yes.
And why did you stop it? Can I
Because
ask?
I didn't like them. They weren't doing me any good. They were doing me more harm than good. I don't like taking pills at all. I haven't taken any tablets at all this year.
Can I ask how you're feeling at the moment?
Well, I've got this tiredness fatigue.
Yeah.
And nothing is doing anything for that. I've lost my drive,
Okay. And
so
how
to
long is
speak.
that? How long have you been feeling like that?
Well, it must be all this year, definitely, yeah.
Right. Okay. So do you think there might be a connection?
No.
It seems like you stopped the thyroxine and you started to feel a little bit more tired and a little bit not have the get up and go. So there may be a link. If we tried it again on a lower dose, it may make you feel better.
Well, we'll go 25 then, yeah?
Okay, so we'll go 25 and then we'll do a blood test in 2 months and then I will personally look at the results and see where we're going.
Okay.
Yeah?
Yeah. It's nice to meet you and thanks for your time.
No problem at all.
And thank you very much.
No problem,
indeed.
take care, bye-bye.
Yeah, thank you.
Too many people in this surgery. I can't keep up with it.
Can't keep up.
Elise, tell us, please. Elise? So, what's happening?
Pain in my chest
Mm-hmm. How long for?
since sort of yesterday, late evening.
Yeah.
Now, I haven't slept very well because pain, I couldn't get comfortable with it.
Yeah.
take a deep breath, it hurts even more.
Yeah.
If I move this arm this way, it
You
hurts.
can really feel it.
Yeah.
Okay. Right there. And you can feel it when you do that.
Yeah.
So if I press on that, okay, that's really sore. Just have a quick listen to see. Deep breaths for me if you could. In and out. Good. Does it go through to the back at all?
Yeah.
Yeah. And every time you move this, then you can just feel it like a stabbing, sharp, really sore pain. What do you do for your job?
A supervisor at a care home for the elderly. So it's quite manual work.
Do you know what you need to do? You need to do more supervising.
Yeah, rather than the manual part.
So you've got something called costochondritis. Have you ever heard of that before?
No.
Sounds a lot worse. Well, it sounds a lot worse than it is. It's not dangerous, okay? But it just feels as if somebody's crushing your chest at the moment, doesn't it? So you've got a breastbone that goes down the middle. You've got ribs that come from the side, okay? And in between the ribs and the breastbone is cartilage, okay? And as it gets lower down, you've got more cartilage. So what you've got is an inflammation between the cartilage and the rib, okay? Often it is a viral type thing. It comes along and affects it. It doesn't have to be. Sometimes we have no idea what starts it off, okay? But it's extraordinarily tender. You can press on it and you just double over in pain. Take your deep breath. Of course, that increases, so that starts to pull it apart, causes a lot of pain. Move your shoulder. Causes a lot of pain, all of those characteristics. It does go away by itself, okay, but it may take a bit of time. It may take a week or two, okay? So I need to give you something reasonably strong to help it.
Okay.
Costochondritis. Yeah, it's a great word. Yeah, there may not be an H there. I can never remember, but that's one of those things.
Okay. Thank you very much.
Okay. See you later. Bye-bye.
Bye.
Hello, how are you?
Went to the pharmacy to pick up the other
That's
prescription.
right, that's right,
And he woke up, and when he woke up, it was just.
Yes, I see. That's right, yeah.
Yeah.
And the other eye seems to be pretty good.
Yeah.
Hello, how are you? Well, I think it is worthwhile treating it because it is quite red and there's quite a lot of pus in it.
Yeah.
And my suspicion is that it's going to get worse. We don't treat these most of the time. They're viral.
Yeah.
Most of them, they clear up. But this looks to be something that's getting, has the potential to get a lot worse a lot quickly.
Yeah.
So we give him something just topical into his eye. And I would like you to use it for 5 to 7 days, depending on how you get on.
Okay.
We're going to give him drops.
Okay.
Yeah. It's highly contagious, so it's very important that you wash your hands after having administered the drops. And then bathe his eye, just rub it around with a warm compress, clean out the green exudate.
Yeah.
But not allergic to any antibiotics as far as you know?
No.
As soon as the pharmacist was trying to describe it, I knew it's something I had to see. Because sometimes these can be fairly mild.
Yeah.
And sometimes you can see in the speed it has developed.
Yeah.
That's
How
right, yeah.
quickly it's come.
Good.
Thank you very much for your help.
You're welcome. Nice to see you. Bye-bye, Sebastian.
Bye.
Bye-bye. Thank you for coming in.
Are you feeling better?
Yes.
Okay, so it's just the medication that causes trouble to you?
Yes.
Okay.
I'm fine now.
You are very sensitive to any medication whatsoever, aren't you? That's what we've learned over the last few months.
I've tried everything before.
That's right.
Everything affects me, and I'm fine now. But as soon as I go on those, I go down.
How much are you smoking now?
10, which means 15, I suppose.
10 would mean times 2, 20 for me. Whenever patients tell they smoke 10.
1.5.
Have you thought about quitting smoking anytime?
I do try. I've tried everything. Hypnosis, you wouldn't believe it. Alan Carr, I've spent a fortune.
Have you? Do you like smoking? Do you enjoy smoking?
Yes, I suppose I do, especially after a meal.
So you're aware that you're at risk of all these issues with the lung and the heart as well?
I know.
Okay.
But I can't take the tablets.
Yeah, let's put to bed the smoking bit. Help is available when you're ready to quit. We've got smoking cessation clinic running on Saturday mornings. That's something you can think of. Let's have a quick look at your heart and see what's going on. If you want to take off your cardigan. Just going to feel your pulse. Okay, I'm just going to listen to your heart.
Is it good?
I will let you know in a moment.
I've got a bad back. When you sit down, it's all like the shooting pains and stuff.
Okay.
It's really sore.
The pain gets me down. This last week was horrible.
It's the most horrendous pain that I've had. I'm just about to hang myself.
I've been getting quite a lot of lower back pain.
Okay.
And now it's getting to the point where it's actually quite bad.
I've suffered with sciatica for quite a long time, but it's getting to the point where it's getting unbearable.
Ah! There.
Yeah.
Okay.
Grab a pew there. And I think you've come for a review about your back, is that right? Tell me what's been happening then.
I do suffer with my back.
Yeah?
I've done for a while,
Yeah.
a long time.
Yes.
I've got prolapse L4 and 5 discs.
Okay.
I was making my bed, my back popped. On Friday I spoke to a GP. She gave me 2 milligram diazepam just to try and relax it, but it just got worse. My whole back here, this side is all locked.
Okay, let's have a little look and see. Let me just pop you up onto the bed a wee minute and sort of see.
This is the hardest bit.
Just laying flat, yeah. Right, I'm just going to lift this leg up for a wee minute, okay? Is that hurting you?
Yeah.
On whereabouts?
On the head.
On that bit, okay. Can you grab that leg and hold it for me? Now, if you can, try and pull it up and at the same time push down. Can you feel that sort of?
Yeah.
Okay. Just relax. It's in your sacroiliac joint. It's not your discs that's causing the problem.
Okay.
And that's where your spine and your pelvis join.
Right.
We need to sort of loosen that up. And the way to loosen it up is to sort of gently manipulate it.
Right.
Now, you can do some of that yourself. So what I was getting you to do there is part of it. Okay. Also, if you're sort of pushing down, gently, I know it's a wee bit sore, but that sort of starts to mobilise it.
Yeah.
The other thing you can do is if you bring the leg up, like so, and then you swing it over around that way hard. Now, it's still quite sore, but if you did that, it'd be hard. I think you'd benefit from some anti-inflammatories around here to try and settle that down.
I can't actually take anti-inflammatories.
Are you worried about your problem with your stomach?
Yeah.
Yeah.
Because I've got a high hernia.
The best way would be to pay and see an osteopath or a chiropractor to loosen that up for you. Do you want a hand up or do you want me to let you get yourself up? I know how you feel, don't worry. It's not pleasant, is it? Do you want me to give you a little bit more diazepam as well?
Please, if that's okay. I've been quite lucky, actually. It hasn't played up for a long time. I was quite bigger. I've lost 11 and a half stone.
Brilliant.
So...
that obviously helps.
Yeah.
The heart is beating fast at the rate of about 110 beats per minute. And it's beating irregular.
What should it be?
It should be around 70 beats per minute.
So it's about 50% OT?
So normal heartbeat will be doing like this. Your beating is like this. Yeah. It's very irregular, very fast. So the heart is not designed for beating faster and irregular. And at some point, it'll give way, causing heart failure issues. And the clot that forms inside that small area called left atrium can get dislodged and cause stroke as well. What are your thoughts?
I've got to do something. I don't want to have a stroke or a heart attack.
Yeah.
Heavens.
Yeah. So you're smoking, your current diet, which you think is not great?
My dad is terrible.
Terrible, okay. So if you're okay with it, I'm going to refer you to the specialist at the hospital. Is that okay?
Mm-hmm.
I'm sorry I could not have much help, but we'll see how it goes. Yeah.
Thank you.
All the best. Bye-bye.
I've come to see you about this hen again, yeah?
Yeah.
All this, pins and needle all the time. These three are okay. This one is some time.
Yeah, and
but this little one, look at that, it's permanently stiff.
Oh, right, I see. And let's have a look at this one.
Got no problem with this one.
So just make a fist on this one and make a fist on this one. Yes, okay? And open them out. So does this feel different? Does it feel numb?
Yeah, this one feels numb, as if I've got pins and needles.
I just want to put a little page of paper between your fingers like this. I want you to hold on to it, and I'll try to pull it away.
Which one, these two?
No, these ones for the moment, yeah. Pull. Yes, good. And then I'm going to pull again. Good. And these two, going to pull again. Okay. So just take off your coat and your jacket.
What I'm worried about
Yeah.
is having watched all these programs.
Oh, yes.
You know when they've got to amputate your foot and it gets all black?
Diabetes, gangrene.
Diabetes, gangrene.
Yeah, no, this is not that. This is your ulnar nerve.
Yeah.
So you have nerves that roots come out of your neck.
Yeah.
They go under here. They then form a big plexus, and then out those come the nerves. And one of the nerves supplies sensation to this finger and half of this finger. And it's called the ulnar nerve.
Yes.
Somewhere between there and here, your ulnar nerve is being interfered with. Stand up for me for a sec. Put your chin on your chest for me. Good. And now put your head right back up. Throw your head right back. Okay, you're a bit stiff in your neck. And I think what's happening is the muscles may be trapping part of the ulnar nerve that's supplying this, and they may be causing it up here. It's happening between your spine here and your plexus under this muscle here. So take a seat. So it's not anything you need to be worried about.
That's fine.
It may recover itself. The ulnar nerve does more than supply sensation to these. It also supplies power to the muscles in the small muscles of your hand. Now, the interesting thing about you is that when you look at your muscles in your hand, they're still just as powerful as they would normally be. So I think this is going to be relatively short-lived because whatever caused it up here, I don't think will continue. But I think if you could do more neck exercises, like chin on chest, head right back, chin over your shoulder, chin over this shoulder, and do those movements maybe 3 or 4 times, and do that 4 times a day, it'll free itself. Yeah.
Thank you very much indeed.
Not at all. You're welcome. I just don't want you worrying about this.
Anyway, nice seeing you.
Yeah.
Thank you very much
Nice to
indeed.
see you, Ned. Yeah,
Bye-bye,
yeah.
then.
All the best. You take care.
Bye-bye.
Bye.
See you soon.
See you later. Thank you. See you then. Bye-bye.
Thanks very much.
Take care.
Bye-bye. Thank you, and you. Bye. Take care then. Bye-bye.
Bye-bye.